Hello everyone, how are you doing guys? My name is Sofia Correa and the topic of the day is acute liver failure complications. We are going to start with the definition. Acute liver failure occurs when your liver rapidly loses its ability to function. More commonly, liver failure develops slowly over the course of years, but in acute liver failure, the liver failure develops in just a matter of days. So the complications that we have in this disease, first we have the excessive fluid in the brain, which is called cerebral edema. Excessive fluid causes pressure to build in your brain, which can displace brain tissue outside the space it normally occupies, which is the herniation. Cerebral edema can also deprive your brain of oxygen. Next, we have bleeding disorders. A failing liver isn't able to produce sufficient amounts of clotting factors, which help blood to clot. Bleeding from ulcers in the gastrointestinal tract or other locations is difficult to control because blood doesn't clot quickly. Infections. People with acute liver failure are at a higher risk of developing a variety of infections, particularly in the blood and in the respiratory and urinary tracts. And kidney failure. Kidney failure often occurs following liver failure, especially in the case of a acetaminophen overdose, which damages both your liver and your kidneys. So here's a little bit about kidney failure.
Kidneys are a pair of about 12 centimetre long, bean-shaped organs. They lie at level of your waist on the back side of your body. Every human being has two kidneys, which lie on the right and left side of the spine. The kidneys produce urine. The urine flows from the kidney through the ureter to the bladder. The bladder passes out the urine through the urethra. Kidneys have three important functions. They filter harmful waste products from the blood and drain them out via urine. They balance the level of fluids and salt in the body. They produce hormones. Chronic kidney disease occurs when there is a change in the structure or function of the kidney. An infection, damage, tumour or side effect of certain medications can cause kidney diseases. A kidney disease often has great implications on health and the functioning of the rest of the body. If you're suffering from a kidney disease, kidney failure can occur.
So if we continue applications in medicine, we are going to see the causes of this liver failure. First, we have viral infection. Hepatitis A, B, and E are the predominant causes for acute liver failure. Also, acetaminophen overdose. Acetaminophen is also paracetamol. Taking too much of this medication is the most common cause of acute liver failure in the United States. Acute liver failure can occur if you take either a very large dose of acetaminophen all at once, or it can occur if you take higher than recommended dose every day for several days, especially in people with chronic liver disease. Now, there are other medications that can cause you to have acute liver failure. Some prescription medications include antibiotics, non-steroidal anti-inflammatory drugs, and anticonvulsants can cause acute liver failure. Also, herbal supplements such as kava, ephedra, skullcap, and pennyroyal have been linked to acute liver failure. Excessive alcohol intake. This is primary. Acute fatty liver of pregnancy, and others such as mushroom ingestion. There are different types of mushroom that can make you have a higher risk of having acute liver failure. Also, autoimmune disease. Liver failure can be caused by autoimmune hepatitis. Metabolic diseases. This is rare. Rare metabolic diseases such as Wilson's disease and acute fatty liver of pregnancy, as I told you, is infrequently, but it can also cause acute liver failure. Now, a video about hepatitis A and B.
If you have hepatitis A or B, your liver is inflamed because you have been infected with either the hepatitis A virus or the hepatitis B virus. Your liver is a soft, flexible organ that performs many important functions. The functional parts of your liver are called hepatic lobules. Your hepatic lobules filter all of the blood in your body. As the blood passes through, your hepatic lobules break down harmful substances. Remove bacteria and worn out blood cells, and forms clotting factors that control bleeding. After a meal, your liver stores nutrients to provide your body with energy when needed. Your liver also makes a substance called bile. Your gallbladder stores bile and releases it into your small intestine to help digest fats in the food you eat. If you have hepatitis A, the virus entered your body when you were exposed to fecal matter from a person infected with the virus. You may have been exposed to the virus by eating contaminated food or water, contact with infected feces, such as during a diaper change, or having unprotected sex with a person infected with the virus. If you have hepatitis B, the virus entered your body when you were exposed to the blood or other body fluids from a person infected with the virus. This could have happened from sharing a drug syringe with an infected person. Other ways you may have been exposed to the virus include having sex with someone infected by the virus, sharing personal hygiene items such as razors or toothbrushes used by an infected person, direct contact with the blood or body fluids of an infected person, or when a mother passes it to her baby during birth.
So be careful when you use someone else's brushes or razors and stuff like that. Symptoms. Signs and symptoms of acute liver failure may include: first, a yellowing of your skin and eyeballs, called jaundice; pain in the upper right area of your abdomen; nauseous, vomiting, a general sense of not feeling well, difficulty concentrating, disorientation or confusion, and sleepiness.
It assumes that you have a healthy patient who has no problems with the liver, and then some insult, whether it be a drug, whether it be low oxygen levels, whether it be a virus, then damage a significant portion of the liver where the person cannot sustain themselves. In order to understand the signs of liver failure, you need to understand what the liver does. If the liver maintains your glucose control, then your sugar can be very low. If the liver clots your blood, then you'll have bleeding. If the liver clears toxins from your body that make you confused, you'll be very confused. The liver also makes the main protein that circulates in our blood that stops us, that holds blood and holds volume, the liquid part of our blood in the blood vessel. So when your liver starts to fail, you start to leak and ooze fluid into multiple parts of your body, including your brain, which is very dangerous, called cerebral edema, and can result in the brain swelling to the point where it cuts off its own blood supply, a very serious consequence of acute liver failure. Or it can distribute into your lung, where you develop problems with requiring intubation for protection of your airway and to deliver the gases that are necessary. So acute liver failure is a medical emergency. It's managed by a comprehensive team that can not only manage the acute liver failure, but also offer rescue therapy through transplantation.
So we continue with the treatment. Acute liver failure treatments may include medications to reverse poisoning. Acute liver failure caused by acetaminophen overdose or mushroom poisoning is treated with drugs that can reverse this effect of the toxins. You can also have liver transplant. Acute liver failure can be reversed in many cases. In these situations, the only treatment may be a liver transplant. During a liver transplant, a surgeon removes your damaged liver and it replaces it with a healthy liver from a donor. Now, the treatment for complications. It goes from relieving the excess fluid in the brain. Cerebral edema caused by acute liver failure can increase pressure in your brain. Medications can help to reduce this fluid buildup in your brain. Screening for infections. Your medical team will take periodic samples of your blood and urine to be tested for signs of infections. If your doctor suspects that you have an infection, you'll receive medication to treat the infection. And preventing severe bleeding. People with acute liver failure often develop bleeding ulcers in the gastrointestinal tract. Your doctor can give you medication to reduce the risk of bleeding. If you lose a lot of blood, you may require blood transfusions. So, a video about liver transplant. So they make an incision, which looks like a very large incision. They don't really explain much in this video, but you can see how it's done. Also, not everyone can get a transplant because there's always a list of donors. There's a waiting list in which there are certain requirements to be acceptable, to be a person who receives a liver. People who are older especially, they don't really give them a priority. So here they're making an incision, cutting. Continuing. Pros. A way to prevent is by getting vaccinated against hepatitis or not eating wild mushrooms. There are different types of treatments. If young enough, there is a high chance of getting a transplant. As I told you guys, people that are older, they don't really get a priority, and it isn't as painful as a pancreatic disease, cancer. Cons. It happens in a sudden way. The transplant may be rejected by the body, and also alcoholics are at higher risk. So people that tend to drink a lot, please quit, or at least try to reduce the number of drinks you have. Chemotherapy may be expensive, and mortality rate is high, which is 80%. If I'm not mistaken, this is the second deadliest type of cancer. Occurrence of the related disease is the hepatic encephalopathy. It is the occurrence of confusion and altered level of consciousness and come as a result of liver failure. Life support may be necessary to help with breathing or blood circulation, and people that have this disease should avoid sedative and tranquilizers. Here's a little bit about the hepatic encephalopathy.
Hepatic encephalopathy, or HE as I'll refer to it later, is a syndrome that primarily affects patients with advanced liver disease or cirrhosis. This is a syndrome that affects the brain and the nervous system, and it can present in a number of ways. It affects the patient's memory and their ability to recall events. It affects their concentration or just their ability to think. It also affects personality, and it can affect the motor system or a patient's ability to move.
What causes hepatic encephalopathy?
We still don't completely understand what causes HE. We know there are toxins that are developed, and we think ammonia is one of those primary toxins. These toxins are coming from the intestines and traveling to the liver under normal circumstances. The liver would then filter these toxins out or remove them. In a patient with cirrhosis, these toxins are bypassing the liver without being cleared, and they travel to the brain. They then enter the brain cells and can cause swelling, which leads to the dysfunction that we see in patients with HE.
So those are the main causes of HE. Thank you guys. Hope you liked the video.